I'm Maureen Brotherton. I'm from Seattle, Washington, and I am the crazy woman who's brought this group together to accompany me to Lira, Uganda, to meet the women in a village. I don't know how to even explain it. To be part of a process of creating global friendships.
I'm Patty Hellberg, and I had a store in Bellevue Square for 25 years, and I am now studying to become a yoga teacher.
Exhale, doming, and inhale, arching your back.
I have never been to Africa.
I'm Kate Perwin. I am an actor by profession, and I have twin 9-year-old boys, and I live in Seattle. This is my first time I've been to Africa.
I worried I was going to starve in Africa, and I really stocked up, but I'm doing okay. I'm Patty Rothwell, and I live in Seattle, and I'm a dentist.
I'm Julie Graylow, and I'm an oncologist specializing in breast cancer. This is my second trip to Uganda. I was here earlier this year, and I'm really here because of our relationship with the Uganda Cancer Institute.
The supply does not match the demand.
This is the Uganda Cancer Institute. It's here at the Malago Hospital in Kampala, Uganda. They treat cancer as an outpatient and an inpatient here. Very beautiful. What is her name? The Fred Hutchinson, the Ugandan government, and USAID have joined forces to building a new cancer institute. So when this opportunity came up, I said, great, I get to go back and revisit the Cancer Institute and all the fellows that we've trained. It might take 6 months once a lump is detected to actually even get a doctor's appointment to come in. So although they're working hard at it and growing it right now, it's very difficult to get access to cancer care. And you have a lot of fluid in here, don't you? With pressure?
Just a little overwhelmed.
Communication is still a big issue.
We're talking about the medical record system and how it's all paper, so it's a bit difficult to find patients and track them, and about 50% of their patients are lost to follow-up.
I think the thing that's so heartbreaking is to have means for diagnosis but no means for treatment, and it's amazing for me because why diagnose it if you can't treat it?
Being in the cancer ward here in Kampala was draining. It was emotional. It was everything you could do not to cry as you walked through the wards, because the life here is so different from the way our cancer patients are treated and cared for. You walk through and you think, is this the best they can have? Is this the same world that I live in the United States? It's not fair.
Thanks for visiting us. Everybody by sharing. Yeah, we have shared a lot of things. Yeah, it's good.
Tomorrow we are leaving for Lira, which is north of Kampala, and we are going to visit a village called Aminocira, and we're going to meet the women in the village and visit a bee farm, share stories, and hopefully help to empower these women in some way. I'm sure it's going to all be very fluid and not exactly sure what will transpire.
We're on our way to Lira.
Light here, beautiful light, beautiful colors, beautiful textures. It's a feast.
Really goats? Oh yeah, the goats are crossing. We are halfway to Lira. We should get there in about 2 hours, and everybody would love to stop and have a nice cold beer somewhere.
What happened?
Watch his door.
We're wondering if there was a tire. We heard a pop and the van shook a little bit, and now we're wondering. But our driver did a good job. We're safely stopped.
I don't think it's a tire.
Sounded like the bottom of the car.
What happened?
So do I. I felt a big bump back here just a little bit ago, so we had to stop, and I guess we're going to go up to the next town and get things checked out.
Welcome to Africa.
Joanne and I are walking across the street to the bar, so anyone that wants to come, here we go.
Let me show you.
Is that you? We're in no hurry. What's the hurry? This is Maureen. We broke down. We're in Chakumba.
How long been here now?
A few hours. It's almost done. It's just going to be a short stop. But we have a good team working on it, that's for sure. And lots of kids cheering us on.
This was really not what I expected. Exciting. It is part of the adventure.
We welded the axle that broke, and finally, after the boys worked several hours on it, we've lowered the car and the axle re-broke. So now we're dividing into 2 cars.
Andrew, don't worry. Don't worry, it's not your fault.
We're adventurous.
Yeah.
You guys don't mind staying?
No, we'll stay.
The women, they're being great. They're just going to wait, and some are willing to stay and sit, and we'll just chat for 2 hours until our ride comes. So it's Africa.
Great roomie. See you in the next life. Have a good adventure.
Doesn't that look good? Anybody want some dinner? Singing a song, side by side.
Yeah, it was a long day, but we got here safely. That was amazing, and even when the axle or the driving shaft or whatever it was broke, the whole bus was able to stop fine. But we're here and we're all bright and we're looking forward to a good day.
It is a big day. It's just hard getting everybody into the cars so that we can get going, but we're trying, and here we go.
What is your name? Margaret? Nice to meet you.
Today is the 3rd time that I visited the village of Aminocira here in northern Uganda, and the reception each time has been warm and welcoming, but today blew me over the top. We had women on the street with palms and dancing and singing and greeting our vans, and we all got out of the vans and danced our way in with the women together, hand in hand, arm in arm.
It's too bad they're so shy and kind of understated, and you'd think they'd want to say hi.
I don't know. We started with 6 hives, about 2 hives, log hive like that. Now we have all these hives. We have honey press here, where we're pressing our honey.
When I came the first time, they hadn't made anything.
No.
This is fabulous.
Yes. She has the heart to help the poor. That's why the community love her so much.
Seeing people have access like this to the water is really incredible, because after walking 2 miles to fetch water every day, it's eased their lives a bit.
All right. Your name,
When I look down on the cement around the base of the water pump, my name is there. So no words again. My heart is bursting, and the love of this community is pretty overwhelming.
Apoya. Apoya. Okay, let's hello you guys.
My name is Sarah. And I'm a physical therapist, and I work with the elderly of my community.
That one is Jane Odongo. She has 10 children. Only 3 are going to school. So now we are faced with a very big challenge, and that challenge is educating our children. She's having the problem of keeping the 20 grandchildren and then the 14 children. She has 12 children. So 7 is alive and 3 died. I mean 5. 5 died. Just 2, I think she's still young. She has only 2 grandsons.
You can't believe in this how many people here are widows and how many have lost so many children. I mean, most have lost at least 2 children. And they're so resilient, so strong, and have such spirit.
My name is Julie, and I'm a doctor and a teacher. And I want to thank you so much for welcoming us into your village. I am so touched. And as I sit here and look at all of the challenges that you have had to overcome, and I see how strong you all are.
Yeah, thank you very much.
I've lived many places, but you have made me feel so at home. So thank you for being here for us and for our exchange.
We are going to extract a tooth on this woman, and she's just having a lot of pain.
That's the one that hurts? Okay, okay.
Oh, this one too.
Isn't she just cool? She's so cool.
And then you wash it? And you use it over and over and over again? Yeah, for many years. The women and the girls don't have money to buy sanitary napkins, and they don't even have the cloth to catch their blood every month when they're on their period, when they're menstruating. And so we brought some cloth and some patterns to try to help the women see a possible way of making cloth pads that can be washed and used, and actually they can last many, many years.
It's important, obviously, for health, good health and cleanness, but there are many studies that say that in developing countries like this, young girls who want to be in school miss as much as 25% of their school days because they're ashamed to be in school when they're bleeding. So they stay home, and then they fall behind in school, and if you fall behind, then you're more likely to drop out. So it's just a really basic part of what you need to be able to get your education.
So this one is with the knickers. You put the cloth inside. You put it on the knickers and snap it closed.
I'm having fun cutting. I must say sewing's never been one of my favorite things, but you know, this is a wonderful thing that a very simple thing too, that we can help, you know, improve these women's lives. So pretty cool.
If she doesn't have any pain, she doesn't have to finish the pain medication.
They just sit there and take the shot, and they don't move at all. They don't flinch. And it's just amazing.
I think we're going to do 3 more. We just have to see how much equipment we have left, how many instruments we have left.
We're making progress.
You can see why I'm not a surgeon.
I wasn't sure what the response would be with such a personal topic, but it was overwhelmingly positive, and they really, really want to participate and to come out with these products and use them for their lives.
They don't have cloth and things to waste. They don't necessarily have sewing skills. Their mothers didn't do it, so they're not learning it from their mothers. And frankly, it's not important to men, and so it's nothing, I think, that's been taken up as a problem to be solved. So it's just something women quietly deal with.
The day now is coming to a close, and we've been actively working with the women all day, and it's been amazing to watch the results of women talking and getting to know one another. It was a bit interesting to have the men not be involved. They were very, very curious about what we were doing, and now I think they're somewhat blown away by the dynamics of what's happened.
Through the discussion we have made, we have found that there's so many similarities. We share the ideas, and we came to know that, oh, so we have the same problems. And we discuss how we can solve the problems. And all of you who have come, we have enjoyed staying with you very, very much.
I think it was a really successful day, but yes, there were some challenges, but in spite of that, it was very, very successful and a joyful day, really fulfilling.
This has been a chance in a lifetime. It's been unforgettable, it's been rich, it's been full, and it's probably going to take years to process, but it was the best.
Do remember us in your prayers, as we shall be doing the same. Frigite, frigita, frigite, frigita, frigita.
There's no words for today. Today has just been incredible. Really joyous.
On the road again. Just can't wait to get on the road again.
From Pacific Crest School in Seattle, Washington, all the children would like to present to you this book of stories.
This one is a great gift given to us, and it is a blessing to the school. And I think this is the beginning of partnership between our school and then the kids that have written this.
When people come to visit us, we feel so good about it. We want to do our best, and when we have people like you, we feel we can even do better. Thank you so, so much. And I wish all of you a very safe journey back home.
Stop it! trying to get in.
That's why there's a special tonight on our room.
This one is a souvenir. Don't smash it.
You're gonna take a picture, right? Oh, I saw
Take it with us.
I don't know, how do you put into words what you've learned from something like that? Compassion, you know, to be more compassionate. And to really think about people, you know, when you're having a meal and, you know, thinking about the abundance that you have and to be grateful for it and just to wish that all people everywhere could be happy, healthy, and live at ease.
I think the connection with the women over those 3 days was something that will be with us forever. And I can't wait to go back.
I will never in my life forget the welcome that we had coming into Aminocira Village. It was beyond belief. I still can hardly wrap my head around it. The joy and the love and the overwhelming sense of warm welcome and excitement and the start of something really important was palpable, and that was terrific.
And I think we were successful in giving the women some hope. And I hope that this group will plan on coming back, if not together, then on their own. But I feel a lot of hope for the future for the village and the women in Aminocira, Uganda.
Don't get out of here.